So I actually get this question quite a bit. Do people still wear hard contact lenses? And I still fit them from time to time. And in fact, in some cases, the hard contact lens might be better than the soft contact lens for that patient. And so in this video, I wanted to go over the pros and cons and the differences so you might know which one might be better for you. Let's focus in. Now, by far, I fit more soft contact lenses in patients than hard contact lenses. Now, when first contacts were starting out, definitely the hard contact lenses are what first came to the market. You had to clean them and treat them a certain way. And as technology advanced, it kind of morphed into soft contact lenses, definitely being the more mainstream type of contacts. And there's still some people that may have started in hard contact lenses and now they are wearing soft contacts, and they're usually the ones that ask me that question, hey, are people still wearing hard contacts these days? And so let's go over the main differences and see which ones might be best in certain categories. First one is comfort, and this might be a given, but that point definitely goes to soft contact lenses. Soft contacts are much easier to get used to the feeling in their eye. When people are first starting off with contact lenses, they can adapt to the soft lenses in their eye much faster. It's easier to get used to how they feel moving around in the eye and blinking underneath the eyelid. And sometimes when people first start out, they really don't even feel them that much. Now, hard contact lenses, completely different ball game. They tend to be thicker. They can move around a little bit. The eyelid feels them a little bit more. And so there's definitely a larger adaptation curve when you're being fit in hard contact lenses. Now, that being said, if you can get used to hard contact lenses, if you can get over that first adaptation curve, that first irritation period, then most people, they get used to the hard contact lenses and it doesn't bother them at all. In fact, it puts them on the same level as soft contact lenses. So initially at first, comfort goes to soft contacts. The next one is handling, actually holding the contacts, putting the contacts in, taking them out. This one's a tricky one, but I might give the edge to hard contact lenses. And the reason why I say this is because soft contact lenses, there is a little bit of an extra learning curve when you put them in and handling them. They can be a little flimsy and sometimes they'll fold over on your finger. There's an inside out, so there's a right way to put the contact lens in, and sometimes you don't know if you're putting it in right. There's a little bit more tricky part to actually keeping your eyelids open because the soft contacts can be a little bit bigger. And so there is a little bit extra handling with care and learning how to take the contacts out. Sometimes it's hard to actually pinch that soft contact out of the eye. Whereas hard contact lenses, it's not flimsy, it's a hard lens, so it's pretty straightforward. It's smaller, so sometimes it's easier to get it into the eye. Taking it out might be a little bit different, but once people learn how to take them out, it can actually go pretty fast and pretty easy. So I give the edge to hard contact lenses, but pretty close. And in that same category, cleaning them and storing them is pretty similar across the board. There might be different ways to clean them, different ways to rub them, and different solutions, but that's pretty even as well. Next one is durability, and I'm going to give this point to hard contact lenses as well. Now, soft contacts can be durable, but they are more prone at ripping or tearing. If you clean them a little bit more aggressively, you can rip the contact lens, and typically they don't last as long. So a lot of contacts maybe last a month, 2 weeks, or 1 day, dailies. Whereas hard contact lenses, they're hard, so they're definitely more durable, less likely to crack or chip, but you can do it. If you push on it too hard, you can definitely break a hard contact lens, but they tend to be more durable and last longer. If you take care of a hard contact lens, if it doesn't get any scratches on them, you don't drop them on the counter, you clean them right, then a hard contact lens can last years. And I've seen patients wear the same pair of contact lenses for years. As long as their prescription doesn't change and it's still fitting well on the eye, they can just keep going with that same pair of hard lenses. Next one up is convenience factor. This point definitely goes to soft contact lenses, and this is probably the main reason why soft contact lenses are the main contacts on the market. They're pretty much off-the-shelf contact lenses. They're factory made in a bunch of different parameters. Most doctors' offices will have trial contacts with a bunch of different powers, so there is a good chance when you go to your eye doctor, you're pretty much expecting to get soft contacts if you're requesting to get contact lenses. And there's a good chance that that doctor will have your power ready to be fit on that day that you can get contacts and wear them out that office on that day. They're definitely more available to purchase. So when you actually get your prescription, you're ready to order, and you can order your contacts right then, and within 2, 3, 4 days, you'll have your year supply of soft contact lenses. They also require much less chair time to be fit in soft contact lenses. The fitting process is usually a lot simpler for the doctor and for the patient than comparing to hard contact lenses. Now, hard contact lenses, they can still be convenient, but there is a little bit more of a chair time, a fitting process, because it's kind of more custom made. There are small little tweaks to make sure it doesn't move around on the eye too much, tweaks to the power, and every tweak that you make, you have to kind of reorder that contact lens from the lab. So you call the lab, they make the contact lens on the spot, they ship it to you, you put it on the patient, you look at the contact lens, and if you have to make another tweak, you got to call the lab back. Hey, I got to make this change to the contact lens. They make the contact lens, ship it to you, try it on the patient, and you kind of keep going from there. That's why the hard contact lens might take a little bit longer, and so much less convenient, whereas the soft contact lens, boom, you get it that day, and if it's good, you can order pretty much that day. Now, which one is safer to wear? This one's almost a tie for me, but I will say this, soft contact lenses, because they're comfortable, it makes it easier for people to overwear them, to abuse their contact lenses. They tend to sleep in them when they shouldn't. They tend to wear them longer when they shouldn't. And this leads to more infections and corneal ulcers and contact lens complications like GPC, giant papillary conjunctivitis. I definitely see more of that with soft contact lens wear, but more people wear soft contacts at the same time. Now, I definitely see complications with hard contact lenses. There are different types of complications, but usually those patients don't tend to sleep in those contacts. They're pretty excited to get the contact lenses out. And so I don't see those type of complications. Hard contact lens wearers can wear them longer than a month. They're designed to do that. And so you don't see those types of complications. So in a way, hard contact lenses can be safer, but there are different types of complications that you can see. So it's about even, but on both sides, if you take care of your contacts, wear them how they should be worn, if you're cleaning them correctly, then the complications can be relatively low on either side. Real quick question for you, do you wear soft contacts or hard contacts? Have you tried hard contact lenses, and what did you think? Let me know in the comments. Now, what about price? Now, there are a lot of things to consider here, but if we're talking about which one might be the least expensive, this point could actually go to the hard contact lenses. With the majority of soft contact lenses, you are buying multiple lenses, whether they're monthly, 2-week, or daily lenses. And most of the contacts, they do have a price for that annual, yearly supply of contact lenses. Now, a hard contact lens, once you get the fit right, you're just going to order that one pair of hard contact lens that could last you years. Now, sometimes if that hard contact lens is just a simple prescription, simple fitting, sometimes the lenses can be $100, maybe $200, and could last you multiple years. And that's why I say that point could go to the hard contact lenses. Now, definitely in the world of hard contact lenses, especially in specialty hard lenses, the price can get pretty expensive. And so there is some caveats there, but generally speaking, the price could be better with hard contact lenses. What about customizability? Definitely the point goes to hard contact lenses as well. Like I said, with soft contact lenses, they make them in certain parameters, and you might have a prescription in a certain brand, maybe astigmatism, that they don't make that exact prescription. You have to kind of pick the closest one. Whereas hard contact lenses, you can customize the contact lenses down to the degree and the exact astigmatism, and also the size of the contact lens. That's one thing that I wanted to mention. Most of the soft contact lenses, they might range in that 14 millimeter size, so it's kind of a standard size for most soft contact lenses. Most hard contact lenses, the normal ones, can be in the 9.5 millimeter range, but you can range that. You can go smaller, you can go bigger, depending on the patient. And if people have different shaped eyes, which we all do, you can custom fit that hard contact lens. It's kind of like ordering a custom shoe that's perfectly molded to your foot. This is what a hard contact lens can be. It can be perfectly shaped to the eye to optimize vision and comfort. And this is one of the main reasons I still fit people in hard contact lenses. There are many patients out there that might have some corneal disease or corneal irregularities like keratoconus, where glasses or soft contact lenses don't give them the optimal vision, whereas hard contact lenses can actually custom mold over that cornea to give them the best vision. Also, there are different types of contact lenses, hard contact lenses, hybrid lenses, where it's a mix between hard and a soft contact lens. There are also larger scleral contact lenses to give people better vision depending on their condition. And there are ortho K lenses. So these type of lenses, you can actually wear hard lenses and go to sleep and then wake up, take those lenses out, and you actually see during the day without wearing glasses or any other contacts. And so ortho K lenses can actually be there as a way of correcting your vision overnight. And then you wake up, you don't have to wear anything, and then you have to wear them again the next night. But that's a great option. So there really is a lot of customization in the hard contact lens world for many patients with many different conditions and many options out there. This brings me to the next one, and probably the biggest one, vision. Which contacts can give you the best vision? And this point also goes to the hard contact lenses. Now, because of the customization, the type of molded plastic, the optical quality of the hard contact lenses, usually people can get very, very good vision with hard contact lenses. Sometimes the best vision that they've ever seen compared to soft contacts or glasses. Now, that being said, soft contact lenses, it can still give you great vision. You can still have 20/20 vision, HD vision, walk around great, seeing great. Now, hard contact lenses, they are on another level. They're just clearer, especially if you're someone with a higher prescription, higher astigmatism, nearsightedness. That's where hard contact lenses can shine, because they can give you great vision where soft and glasses can't. And like I said before, people with certain eye conditions or eye diseases, sometimes hard contact lenses are the only way that they can actually have adequate vision. Now, as you can see, there are a lot of reasons to wear hard contact lenses, and that's why they're still out there, and a lot of patients still wear them. Now, soft contacts, they can be more comfortable and convenient, and that's mainly the reason why most people wear soft contact lenses. But yeah, don't let the hard contact lenses go to the wayside. A lot of people still wear them and love them. Now, if you are new to contact lenses, definitely check out my playlist right here if you want to learn more about the contact lens world, or check out my video right here. I'm Dr. Neil Gaiman, Dr. Eye Guy. Stay focused.